I'm Sharon Patton, the pharmacy director at Walker Baptist Medical Center, and I got into healthcare because I just wanted to be a pharmacist. From the time I was in ninth grade, I was very interested in medicine and chemistry, the way that drugs work in your body, different antibiotics treat different bacteria differently, and that was just interesting to me. It wasn't necessarily I do want to help people. I do want to help patients, but I knew that I really wasn't going to be hands-on like a nurse. So that was the reason. I've worked at Walker for 30 years, and during the pandemic, when it first started, in the beginning, July, August, in our department, one of our pharmacy techs lost her husband to COVID, and we lost one of our pharmacists to COVID in August of that year. And so from the very beginning, it was very near and dear to our heart. We knew how serious it was, and we didn't really have an option of stopping. We had to keep going, and we didn't even really have time to grieve the loss of our friends and loved ones either. But we also knew our coworkers were suffering, so we're support staff to our nurses, and our nurses were struggling, and we had to make changes in our department to do things more efficiently because we were having to do so much more work with the same staff. And so it was a challenge, and we don't mind challenges, but also I don't even think we know what the word quit means. That's not in our vocabulary. The thing I love the most about my job is taking care of patients, the clinical side of pharmacy, where a lot of people don't realize that in a hospital there's a pharmacist looking at all of their medications to make sure that all the doses are correct based on how their kidneys are functioning or what kind of bacteria they have, and we look at cultures to make sure that they're on the right antibiotic. So there's a lot that goes behind the scenes, and I love that part. But also I love my coworkers, and not just in the pharmacy but in the rest of the hospital. It's like family here. We've worked here, a lot of us have worked here a long time, and it's just like home.